Peritoneal dialysis is a medical treatment for individuals with end-stage renal disease, ESRD, or severe kidney dysfunction. It's one of two primary methods of dialysis, the other being hemodialysis. Peritoneal dialysis works by using the peritoneal membrane, a natural filter in the abdomen cavity, to remove waste products and excess fluids from the body. Here's a comprehensive overview of peritoneal dialysis. Number 1. Indications for peritoneal dialysis. Peritoneal dialysis is typically prescribed for patients with kidney failure, or ESRD, when their kidneys can no longer effectively filter waste and excess fluids from the blood, which can have serious health consequences if not treated. ESRD is a term used to describe the final stages of chronic kidney disease, CKD, when the kidneys have lost almost all of their function. To put it simply, ESRD occurs when the kidneys are functioning at less than 15% of their normal capacity. This indicates a severe and irreversible decline in kidney function, and individuals with ESRD typically require some form of kidney replacement therapy, such as dialysis or kidney transplantation, to survive. Number 2. How peritoneal dialysis works. Peritoneal dialysis, PD, is a renal replacement therapy that utilizes the peritoneal membrane, a natural filter located in the abdominal cavity, to remove waste products and excess fluids from the body. It involves the use of a sterile dialysis solution, known as dialysate, which is introduced into the peritoneal cavity through a catheter surgically implanted into the abdomen. The peritoneal membrane is rich in blood vessels and capillaries, making it an ideal location for the exchange of waste products and electrolytes. Dialysate is introduced into the peritoneal cavity for a specific waiting time, during which waste products and excess fluids diffuse through the peritoneal membrane into the dialysate due to the concentration gradients. Afterward, the used dialysate containing waste products is drained via the catheter, effectively eliminating harmful substances. This cycle is repeated throughout the day and night depending on the type of PD, ensuring continuous waste removal and electrolyte balance maintenance, ultimately reducing complications associated with kidney failure. Number 3. Types of peritoneal dialysis. Peritoneal dialysis comes in two primary forms: continuous ambulatory peritoneal dialysis, CAPD, and automated peritoneal dialysis, APD. These methods differ in how they're administered and the role of technology in the process. Here's an explanation of each type. Continuous ambulatory peritoneal dialysis. CAPD is a manual form of peritoneal dialysis where patients independently perform 4 to 5 daily exchanges. This involves introducing fresh dialysate into the peritoneal cavity, allowing it to dwell for 4 to 6 hours, and then draining the used dialysate out. CAPD offers flexibility but requires strict adherence to a manual schedule. Automated peritoneal dialysis. APD, or continuous cycling peritoneal dialysis, CCPD, uses a cycler machine overnight. It fills the peritoneal cavity with fresh dialysate, dwells, drains, and repeats. APD is more automated, involving one daytime manual exchange, ideal for those with busy schedules or a preference for automation. Both CAPD and APD have their advantages and considerations, and the choice between them often depends on the patient's lifestyle, preferences, and medical condition. Healthcare providers work with patients to determine the most suitable type of peritoneal dialysis based on individual needs and circumstances. Number 4. Pros and cons of peritoneal dialysis. Pros. Flexibility. PD offers the flexibility of home-based treatment. More gentle removal of fluids. Gradual fluid removal helps stabilize blood pressure. Fewer dietary restrictions. Fewer dietary limitations compared to hemodialysis. Preserves residual kidney function. May preserve remaining kidney function. Lower costs. Can be more cost-effective than in-center hemodialysis. Cons. Infection risk. Higher risk of infections, including peritonitis. Time commitment. Requires multiple daily exchanges for some. Catheter-related complications. Potential catheter issues. Limited clearances. Less efficient at removing certain waste products. Dietary restrictions. Some dietary restrictions may still apply. Membrane changes. Effectiveness may decline over time. Number 5. Monitoring and follow-up. Monitoring and follow-up in peritoneal dialysis includes regular clinical assessments, fluid balance monitoring, routine blood tests, and peritoneal equilibration tests to assess the peritoneal membrane function. Healthcare providers review and adjust the PD prescription, educate patients on catheter care and infection prevention, and manage medications. Ongoing patient education is emphasized and concerns are addressed promptly. For suitable candidates, discussions about kidney transplantation as a long-term option may be initiated. These measures are essential for optimizing PD effectiveness, managing complications, and ensuring patient well-being. Number 6. Patient education. Patient education for peritoneal dialysis covers key areas such as catheter care, proper dialysis procedures, infection prevention, medication management, dietary restrictions, and emergency response. Patients learn how to maintain their catheter's hygiene, perform PD exchanges, recognize signs of infection, manage medications, follow dietary guidelines, and troubleshoot equipment issues. They're also encouraged to communicate with their healthcare team, attend follow-up appointments, and maintain a healthy lifestyle. This comprehensive education empowers patients to manage their PD treatment effectively and maintain their overall well-being. Number 7. Dietary management and fluid intake. Managing one's diet is fundamental for PD patients, involving strict control over potassium, phosphorus, sodium, and fluid intake. This dietary management plays a vital role in maintaining electrolyte balance, managing blood pressure, and preventing complications. Collaborating with registered dietitians helps patients create personalized nutrition plans tailored to their treatment goals and nutritional requirements. In contrast, careful monitoring and control of daily fluid intake are crucial aspects of effective PD treatment, as excessive fluid consumption can lead to complications. Patients receive guidance from healthcare providers on limiting fluid intake based on individual needs, ensuring that fluid balance is adequately managed. Number 8. Exercise, lifestyle flexibility, and emotional well-being. Encouraging regular physical activity is important for PD patients' overall well-being. Exercise enhances cardiovascular fitness, physical health, and emotional well-being. However, patients must work with healthcare providers to establish safe and suitable exercise plans. Maintaining a balance between staying active and avoiding overexertion is key. Furthermore, PD offers lifestyle flexibility, enabling patients to travel and engage in various activities. Adequate planning and effective communication with healthcare teams can make this happen. Additionally, the emotional aspect of living with a chronic condition should not be overlooked. PD patients may experience stress, anxiety, or depression related to their condition. Seeking emotional support such as counseling or participation in support groups can provide valuable tools for coping with these challenges and improving overall well-being. Number 9. Kidney transplantation as an option. Kidney transplantation is often considered the ultimate goal for individuals with end-stage renal disease, including PD patients. It offers several advantages, such as improved quality of life, freedom from dialysis, better long-term outcomes, fewer dietary restrictions, and increased physical activity. Patients interested in transplantation undergo a comprehensive evaluation to assess their suitability. While waiting for a donor kidney, they continue PD treatments to maintain their health. After surgery, patients must take immunosuppressive medications to prevent organ rejection and require ongoing medical care and monitoring for optimal kidney function. The decision to pursue transplantation is highly individual, influenced by factors like overall health, compatibility with donors, and personal preferences. However, it's essential to acknowledge potential risks and long-term commitments, including immunosuppressive medications and post-transplant care. Transplant candidates and recipients should engage in thorough discussions with their healthcare team to make informed decisions about pursuing transplantation as a long-term solution for managing ESRD. In conclusion, peritoneal dialysis is a vital lifeline for individuals facing end-stage renal disease, offering the possibility of improved quality of life and treatment flexibility. Whether through continuous ambulatory peritoneal dialysis or automated peritoneal dialysis, PD empowers patients to manage their health at home. While it's important to consider the lifestyle adjustments and potential complications, PD can be a life-sustaining treatment option. For those on this journey, understanding the ins and outs of PD and its considerations can make a significant difference in their lives. Remember, your healthcare team is your ally in this journey, providing guidance, support, and tailored care to ensure the best possible outcomes. Here's an idea. How about you check out this playlist right here talking about dialysis? I'm trying to grow my YouTube channel, so if you've gotten value out of this video, give it a thumbs up, share this video with someone, consider subscribing to the channel as I'll be uploading more kidney related content shortly. And I'll hopefully see you in the next video. Take care.